Let's talk about the government shutdown and healthcare cuts. A shutdown happens when Congress misses the deadline to pass a budget or a short-term funding bill. Without that, the government loses the authority to spend money. That means agencies close their doors, hundreds of thousands of federal workers are either furloughed or told to work without pay, and services people depend on, like passports, food safety inspections, and medical research, slow down or stop entirely. So while it sounds like it's just politics in Washington, it actually impacts all of us. So why can't Congress just pass a budget? Right now, Republicans control both chambers, but just barely. So even a handful of lawmakers can stall a deal. The real sticking point is healthcare. Democrats want this funding bill to restore two key programs that are scheduled to be gutted next year by the Big Beautiful Bill Act. First, healthcare subsidies. These are what make insurance affordable for millions of families under the Affordable Care Act. Without them, premiums could spike more than 75% for the average enrollee, pushing an estimated 4.2 million more Americans out of coverage over the next decade. And if you think this won't affect your insurance, think again. Insurance only works when the risk pool has a healthy balance. Younger, healthier people who use less care and older, sicker people who use more. If millions of healthy, lower-income Americans drop out, that balance breaks. The pool gets older and sicker and costs rise, and insurers respond by raising premiums or leaving high-risk areas entirely. That chain reaction is called adverse selection. And it doesn't just hit ACA plans, it spills over into employer coverage too. You could see higher payroll deductions as premiums climb, bigger deductibles and copays as companies try to contain costs, and fewer plan options, especially in rural markets. Health insurance only works when enough healthy people are in the system to offset the sick. By tipping that balance, the Big Beautiful Bill risks raising premiums across the board, even for people who never bought coverage through the ACA marketplace. Second, Democrats want to reverse the cuts to Medicaid. This program covers low-income families, seniors in nursing homes, and people with disabilities. Cuts here mean fewer people get care, or states have to pick up the tab, if they can. Now here's where the politics comes in. These programs do not cover undocumented immigrants. Medicaid and ACA subsidies are only available to U.S. citizens and certain legal residents. And before you zoom in on the legal residents, I did some digging. Only about 6% of people on Medicaid under age 65 are non-U.S. citizens, so 94% of people receiving benefits are U.S. citizens. But some Republicans are framing this fight as if Democrats are trying to give taxpayer-funded health care to people who are here illegally. That's not accurate. It's a spin designed to fire up voters and avoid the real issues. The real debate is whether to restore Medicaid funding and ACA subsidies for millions of working families. Democrats say these protections are too urgent to delay. Republicans want a clean bill with no extras and argue healthcare should be debated separately. Neither side is budging, and that's why we're staring down a shutdown. Fall for more simple economic and market updates.